everyone, my name is Shiran, and today I'm going to be talking to you about why we should vote for the expansion of Medicare for all. Did you know that 1 in 5 Americans cannot afford or have any access to healthcare coverage? Medicare for All is a bill that would be regulated and partially financed by the U.S. government. Currently, 58% of Americans do support Medicare for All. This bill will give equal opportunity of healthcare coverage regardless of income, homeless people, your limited access. It will create equality and socialism for all people in America, and citizens will not have to pay any out-of-pocket expenses or co-pays, and that goes for everyone who is an American citizen. This pertains to everyone here because everyone needs healthcare insurance, right? I know that when I left my parents' house and I was on my own, I had to do a lot of research, and after doing that research, I found that Medicare for All is the best option, and I find it to be the best option not just for me, but for everyone, especially most of you guys who are probably over the age of 18 and looking for insurance of your own. By voting for Medicare for All, we are creating an equal opportunity for healthcare insurance, giving millions of citizens the healthcare access they are in need of. First, I'm going to talk to you about how Medicare for All will allow millions of American citizens to finally get the healthcare they could have never afforded. Second, I want to talk to you about how it will lower the U.S. healthcare costs overall. And finally, I will speak to you about how Medicare for All will lower the complexity of the current healthcare system we have now. To start off with, Medicare for All will allow millions of citizens to finally get the healthcare coverage they've never had access to. There are millions of citizens, including men, women, and children, who could never afford or have any access to any kind of insurance. According to ABC News, in 2008, almost 20% of American citizens can't afford healthcare coverage or have any access to it. The numbers since then, in the last 20 years, have only increased. According to Stephen Reinberg of Health Day Reporter in 2008, almost 1 in 10 people aged 18 to 64 years reported not being able to afford prescription drugs, and 10% of those people also said that they have pushed off any type of checkup appointments or even surgeries because they, at the moment or currently, cannot afford it because they don't have healthcare coverage. America has a large population of low-income citizens as well as homeless people, and Medicare for All would give them the equal opportunity to have this healthcare coverage. Everyone, including those with limited and low income, would not have to pay deductibles or any co-pays or any out-of-pocket expenses. According to MediaCareResources.org, in 2019, the Medicare savings programs will pay premiums, deductibles, co-pays, and current co-insurance for enrollees with limited income or access. The federal poverty level is very large and includes many people who are in need of this affordable coverage and will receive it if we vote to expand Medicare for All. Now that I spoke to you on millions of citizens will finally be able to receive the healthcare coverage they need, I want to talk to you about how Medicare will lower the U.S. healthcare costs overall. The health spending in America is the highest in the world, as we can see here. It's not just in the millions, it's not just in the billions, it's actually in the trillions. According to JAMA, in 2016, we have reached up to $3.3 trillion in U.S. healthcare spending. Healthcare is extremely expensive, and it is creating a healthcare crisis in America. In Rooney Patrick's book, America's Healthcare Crisis Solved, he mentions how healthcare is really all about money and how the healthcare system is so expensive that it's not just the homeless or low-income people who can't afford it, it's also now the middle class where that can't afford it, and a lot of people, I would say maybe even most people between low-income and middle-income people fall under that category. So many people cannot afford these private health insurance companies. By expanding Medicare, it will also lower health spending and taxes. And according to Healthcare Triage, instead of paying a premium for profit insurance companies of $5,000, Americans would only have to pay $1,000, which benefits both business owners because they are paying less for their employees' insurance, and it benefits employees because they're business owners, people they're working for, can pay them a higher salary and give them more benefits because the money is not all going to their insurance. Now that I spoke with you on how Medicare will lower the healthcare costs overall, I want to speak with you how Medicare will lower the complexity of our current complex healthcare system. Healthcare would be run by the government, lowering the complications that healthcare deals with. According to Masterclass in 2019, on a federal level, the universal healthcare lowers healthcare costs for the national economy because the government controls the prices of all prescription drugs and all the services. So the government will be able to control everything, and people can just kind of make their own prices. Medicare for All will also help both doctors and patients because doctors and the medical staff will not have to deal with so many different private insurance companies. They will actually just be dealing with one government-run coverage, and it'll save a huge amount of time and money and headache for both the medical staff and the patients that we are always dealing with when we go to the doctors. In 2019, Medicare for All Sarah Fisher mentions how it would eliminate the administrative cost of working with multiple private health insurers, and it would just be one government agency for everyone. I hope by now you have a greater understanding of why we should vote to expand Medicare for All. Medicare for All will create an equal opportunity, giving millions of American citizens the healthcare coverage they need and have never been able to afford. First, I spoke with you on how it will allow these citizens to finally get the healthcare they could never afford. I spoke with you about how it will lower the U.S. healthcare costs overall. And lastly, I spoke with you on how it will lower the complexity of our current healthcare system. By voting for Medicare for All, we can finally create a social economy where everyone in our society is treated equally. I mean, look at this pandemic we're in right now. There are thousands of people who cannot even be treated or looked at for their symptoms, and it is causing them to get very sick or even die because they don't have the healthcare coverage they need in order to be able to go to doctors. And of course, hospitals are filled up right now, so we can't even go to hospitals. We can see this with the pandemic we're in right now. It is literally a life or death matter when it comes to Medicare for All. By the government expanding Medicare for All, we are giving all American citizens, myself included, many of you, if not most, included, the essentials we need in order to survive by caring for the well-being of people. So if you care for your friends, your families, your neighbors, and your fellow American citizens, we should all vote for the expansion of Medicare for All. Thank you.